Welcome to Module 2, Lesson 2. Now that you understand the importance of consultations, let's talk about how to determine if a client is a good candidate for plasma fibroblast. By the end of this lesson, you'll know exactly what to look for when assessing a client, including medical contraindications, skin type classification, and necessary pre-treatment steps. You'll also learn how to guide clients in budget-friendly treatment planning to help them make the best choices for their skin and finances. Let's get started. Before performing a plasma fibroblast treatment, you must first check for contraindications. These are medical conditions or factors that could make the procedure unsafe or lead to unwanted side effects. Always begin by reviewing the client's medical history. Ask them if they have any pre-existing conditions, allergies, or medications that might interfere with healing. Some major contraindications to watch out for include pregnancy or breastfeeding, diabetes or poor wound healing, a history of keloid scarring, undergoing chemotherapy or having cancer, and taking blood thinners or immunosuppressants. If a client has any of these conditions, do not proceed with the treatment. Always prioritize their safety first. Once you've ruled out any contraindications, the next step is assessing skin type using the FITZPATRICK scale. This scale classifies skin tones based on how they react to sun exposure and healing. FITZPATRICK 1 and 2, normally safe for treatment. FITZPATRICK 3 and 4, requires caution. Always do a patch test before treatment, and if required, ask the client to pre-treat their skin with hydroquinone or kojic acid for 3 to 4 weeks to reduce pigmentation risks. FITZPATRICK 5 and 6, not recommended due to a high risk of hyperpigmentation. Pro tip: if you're unsure of a client's skin type, always play it safe by performing a patch test or following a pre-treatment plan before proceeding. Avoid treating clients who use tanning beds or tanning pills. These can cause severe hyperpigmentation after treatment. Advise your client to avoid the sun, tanning beds, and all tanning products or pills for 6 weeks before treatment and a minimum of 3 months post-treatment. They should also use SPF sunblock for 3 to 6 weeks before treatment and a minimum of 3 months post-treatment. No treatment program would be successful without daily sun protection, and your efforts will be pointless otherwise. The preventative power of plasma fibroblast. While plasma fibroblast is great for smoothing existing wrinkles, its preventative effect on collagen production is even more valuable. Clients don't always need 2 or 3 follow-ups for the same area to see noticeable results. Younger clients may benefit from early intervention. Encourage them to start plasma fibroblast treatments for loose skin and frown lines as soon as they appear instead of waiting until wrinkles deepen. Early treatment may require just 1 session and a follow-up in 3 to 4 years, instead of multiple follow-up treatments. This makes it far more cost-effective in the long run. As a technician, you'll not only assess your client's skin, but also help them plan their treatment in a way that fits their budget. After evaluating their skin, you'll provide a quote for the appropriate treatment. Since pricing varies by location, some clients may find plasma fibroblast treatments expensive. To make it more accessible, you can offer payment plans or discounts, especially if they'll need multiple sessions. Great job! In this lesson, you learned how to identify contraindications, how to use the FITZPATRICK scale to assess pigmentation risks, the importance of pre-treating FITZPATRICK 3+ clients, and determine if a client is a safe candidate, how to offer budget-friendly treatment plans, and early intervention. Don't forget to download your detailed contraindications list and FITZPATRICK scale reference chart. In the next lesson, we'll dive into how to assess skin laxity and set realistic client expectations. See you there!